I am State Representative Toni Rose, and I proudly represent House District 110 in the Texas House of Representatives. I want to thank Children at Risk and the Texas Family Leadership Council for providing a platform to celebrate motherhood and unpack the issues that impact mothers. Today, I want to briefly speak with you all about maternal health and next steps. As many of you know, during the 87th regular legislative session, we passed House Bill 133 to extend Medicaid coverage from 60 days to 6 months for new mothers and to add the Healthy Texas Women to a managed care program from feed to service. This success wouldn't have been made possible without the hard work of advocates and professionals like yourselves. House Bill 133 ensured that new mothers receive the necessary treatments and continuity of care that save their lives. Going into the interim, I had planned to study the progress of the 6-month extension in hopes of extending Medicaid coverage from 6 months to 1 year. However, due to the public health emergency, those plans are on hold. The good news is that new mothers whose eligibility have since expired are still using Medicaid due to the public health emergency that requires those utilizing these services continue to do so. The public health emergency is supposed to be extended until July, but part of me wishes it lasted longer so that more mothers would get the assistance they need. Currently, the postpartum eligibility extensions, HHSC, intends to amend the 1115 transformation waiver. The proposed effective date for this amendment is September 22, 2022. Implementation is contingent on CMS approval of the 1115 waiver amendment. For the Healthy Texas Women Managed Transition, HHSC is seeking CMS approval through the Healthy Texas Women 1115 waiver, but we do not have a public notice of intent yet. The target implementation date will be 2024, and implementation is contingent on CMS approval. While I am thankful for the progress we are making as a state, we still have work to do. Initially, House Bill 133 was to extend Medicaid coverage for a year. Unfortunately, while there was a bipartisan desire for this change, there was a lack of political will in the Senate leadership. Access to medical resources and counseling will save lives if available to poor mothers whose safety net disappears 60 days after delivery, despite the fact that medical experts say new mothers are at risk of suffering psychological and medical setbacks for a year or more. Healthy People's 2030 goal is to reduce the maternal mortality rate to 15.7 maternal deaths per 100,000 live births, the rate it was in the early 2000s. We just observed Black Maternal Health Week a few weeks ago. Black women are more than 3 times likely to die from pregnancy-related complications as white women, regardless of education or income. Black women in Texas are disproportionately affected, accounting for 11% of live births, but 31% of maternal deaths. Wide racial and ethnic disparities exist nationally too. For the maternal mortality crisis to end, we must center our solutions around communities most impacted. Improving maternal health outcomes means investing in solutions that erase health disparities for communities of color and poor mothers. We must end policies that deny equitable access to health care and work to further expand access of maternal care, reduce healthcare costs, and make new investment that equalizes the playing field, including expanding and diversifying the maternal workforce and improve maternal mental health treatment. Texas has some of the most committed providers and brilliant scientists and doctors. We can better train our providers and allocate funding to enhance research that will ultimately improve maternal health. Women play a critical role in our society. The fabric of our families and communities are threatened when our women do not receive affordable, quality health care. In 2019, the American Medical Association adopted a policy to support the extension of health coverage to 12 months postpartum, acknowledging postpartum health care coverage is needed to aid a mother after pregnancy. This 1-year extension of coverage period would provide new mothers with comprehensive medical coverage they often need after birth of a child, a change that would benefit children as well as mothers. The Biden administration recently initiated incentives for our state to expand postpartum coverage to 12 months. Illinois was the first to have its extension approved, and a few other states like Florida and Connecticut have also followed suit. Texas is leaving money on the table. In the next legislative session, we will continue to fight for the full extension to provide comprehensive medical assistance for women following the date women delivers or experience an involuntary miscarriage. I want to thank each of you for your dedication of ensuring that our mothers are healthy, ensuring that our mothers are safe, and ensuring that our mothers receive the medical treatment that they need. I want to thank you again for the opportunity to be with you all today, and enjoy the rest of the conference.